Number one, for the person who asked, will AI disrupt doctors? The answer is yes. I'm part of that revolution. I'm going to give you a first flavor for it. And we're going to try to make the medical profession completely obsolete, the way it is today. Secondly, I remember, Jason, just now you said, the more you have clinical experience, the more resilient you're going to be. There's a downside to that, Jason, which is the longer you keep doing the things the same way, the more hardened you are, the less willing you are to change, and the more likely you're going to be left behind, swept away by the new forces of technology. And third, we are hiring. So if you're excited to kind of be a part of a completely different way of doing healthcare, different from what it's done today, please reach out to me on LinkedIn. You guys ready to rock and roll? Awesome. So a little bit very quickly. Obviously, I'm not a doctor, but I've been in a number of different industries. I built an airline with zero airline experience. With one plane, we had to take on global giants like Emirates and Singapore Airlines and Cathay Pacific. You do that by doing things differently. You notice, if you've been in the industry for decades, if you're Malaysia Airlines, you're not likely to be the one disrupting the airline industry. You will always be behind smaller than the global giants. With iFlix, we started with 5 guys in Mid Valley in Kuala Lumpur. 115 investors said you don't stand a chance against a global giant like Netflix. iFlix scaled to 20 million users in 20 countries in 3 years. If you're Astro or Media Prima, for 20 years, you're just in Malaysia. Because if you start doing things one way, you cannot change from within. And now I'm in healthcare. I started Naluri with one single intern in my living room in 2017. Because when you look at all these big hospital groups, till today, still in Malaysia. Naluri, our team now is about 300. We've got teams in Indonesia, Singapore, Thailand, Philippines, and we're about to expand into North Asia and Africa in the next couple of months. We do that by doing things differently. So let me start by talking about healthcare. I look at it from the lens of what are the fundamental problems with healthcare today. You know, when other people talk about digital, all they're talking about is digitalization. Digitalization is boring. What you do is just you look at something that's offline today and you try to make it incrementally better, a little bit more efficient using digital. Instead of manually calculating, I use an Excel formula. Big deal. We've got to really look at what are the fundamental issues and reimagine something completely different. Here's our take on it. Number one, healthcare today is reactive. You wait for patients to get sick and you wait for patients to come to you. That model needs to change. It needs to change to a model where we can do a lot of predictive analysis, find populations that may be healthy today, apparently, but have early risk factors, and help them proactively, instead of waiting for them to be sick and distressed and then expect them to come to you. So doctors are actually a very reactive bunch. Secondly, every doctor is only looking at one part of you. The cardiologist looks at your heart, the gastroenterologist looks at your gut, the dietitian looks at what you eat. Humans are not compartmentalized. We are a whole holistic human. And we've got to reimagine care from one that's siloed by specialization to truly coordinated and multidisciplinary care. How do we do that at scale? Instead of making one patient see different specialists for different parts of the health, imagine if every patient had their own multidisciplinary team, their own psychologist, dietitian, doctor, fitness coach, pharmacist, all working as a team for the whole year, rather than just one single episodic consultation. And third, what frustrates the people who have to actually pay for healthcare, with its employers, insurers, probably even our governments are saying, why is it that every year our cost of care is growing at 10 to 15% each year? That's 2 to 3 times the rate of GDP, and yet more people still get sick. Because the problem with healthcare is today, it's a fee-for-service model. Your doctor gets paid for the consultation, the prescription, the treatment, irrespective of whether the patient gets healthier or not. That's good for the doctor. Sucks to be the one who's the patient who has to pay for the bill, right? It's time to change that. Why do we have to do things the same way over and over again? And it starts by moving healthcare from just what is the service that you provide to the outcomes that you deliver. So we start again. For example, being very, very focused on quantifying simple metrics, because these basic metrics have very strong predictive value to future significant healthcare costs, whether it's your weight, your HbA1c blood sugar, your cholesterol profile, your blood pressure. What are the starting risks across populations, whether it's employees in an organization, policy holders of insurance companies? How much can we improve over time? And at the same time, we also start to quantify depression, anxiety, and stress. Unsurprisingly, the same people in yellow and red here are the same people in yellow and red there, right? And that is why you've got to address mental health and physical health together. But healthcare providers rarely do. You got to go beyond that though. What does it mean to improve your HbA1c by 1.2%? What does it mean to reduce blood pressure by 20 millimeters of mercury? What is the dollar value of that? You got to push that thinking beyond. So what we've done, we start building healthcare economic models to be able to calculate what's the value of improving health. In this chart on the left, on the x-axis, are 5 basic comorbidities, right? So these 4, which is your weight, blood sugar, blood pressure, cholesterol, and I summarize depression, anxiety, and stress into a single factor. We've analyzed about 500,000 Malaysians, 6 years worth of medical claims data, days of sick leave. If you've got 5 out of 5 comorbidities, that means you're overweight, you have hypertensive blood pressure, you have high cholesterol, you've got diabetic level blood sugar, and you're mentally distressed, you're costing the company about $6,100 US per year. 4 out of 5, 4,400, 3 out of 5, 3,200. So certain populations that get enrolled in our program, 10% may have 5 out of 5, 20% may have 4 out of 5 and stuff. You got a distribution curve. As we get them healthier, you can see that distribution curve shift to the left. And you can now calculate the mean cost, right? So this particular cohort may cost an organization $3,200 US a year, but with the kind of improvements we do, we can bring that median down to $2,200 a year, which means you're creating a value of about $1,000 US per enrolled employee per year. Even if half of them succeed and half of them fail, that's already $500 US value per enrolled per year. If we can deliver that entire program in less than $100 US a year, that means a 5 times return on investment. For a lot of our corporate clients, they've never had any big healthcare provider talk to them about what is the value, the dollar value, the ringgit value of improving healthcare. You can take that a step further to then say, we can build healthcare cost prediction models. Because we now have about 300,000 mental health data sets, 30,000 biomarker profiles, 6 years worth of healthcare costs claims data, we can, as we do a lot of early health screenings, which I'll share later, you can then help an organization quantify, if you do do nothing for your population, this is how much your healthcare costs. The claims, the sick leave is going to escalate over time.